First, are doctors being reckless by striking? Yesterday, talks between the government and union leaders failed. The British Medical Association says the government has not offered big enough improvements in working conditions. It says pay remains the key issue for resident doctors, the new name for junior doctors. On Friday, up to 50,000 resident doctors will begin their 5 days of walkouts in England. Meanwhile, the NHS Chief Executive, Sir Jim Mackey, has told hospitals to continue with routine appointments despite concerns that this will spread senior doctors too thin. So the BMA is saying, oh, you can't do that, but actually it looks as if they're going to try and do the appointments, James. What do you think?
Yeah, it's a really complicated thing, you know, when you start to look at it and start to pick it apart. I mean, look, ultimately nobody wants strikes in healthcare. Okay, least of all the people that have dedicated their entire lives to it. But
well, they look there as if they rather do want them.
No, yeah, but what choice do they have?
Oh, I mean, please, are you serious?
You're asking people to make life or death decisions on £17 an hour. And they're not asking...
Where have you got that £17 an hour figure from? They're not on 17.
They are on 17.
They're not.
They are.
Well,
yes, they are.
Not.
Well, that doesn't include their pension rights.
Yes, it's not even that. It doesn't include their overtime either. And all of them do overtime. If they work over 37 hours a week, they get overtime. If they work weekends, they get overtime. If they work... in fact, I've got it written down here.
I saw... Go on, because we can trade the figures here, but it's...
I saw a pay slip last night on social media from a junior doctor called Imogen Arden-Jones, and she breaks it all down for you. So her monthly take-home, £3,051. She earned £362. Carole, £362 in overtime and £152 for a weekend. Her deductions were £1,000, right? So her take-home for the month was £2,514.
Okay. I ask you the question again. How long has she been a doctor?
Well, she's been training for 6 years.
That's nonsense. That is just so much nonsense.
She's just started being a doctor because she's been training for 5 years. Yeah.
She's been at university for 5 years.
First year.
So in your first year, in your first few months, that's the money you get. After that, it goes up. And when it goes up in your first year, they get something like 47 grand. But by the time you get to year 3, you're on nearly 60 grand. And you have all of those things. You have overtime for social hours. You have overtime for weekends. You have, if you work over 37 hours, you get overtime. They never put those figures into when they're talking about it. This is a disgrace. If you go into healthcare, you should not be abandoning the patients you have taken a vow to protect. And I'm sorry, you say that they're on little money. They're some of the highest paid public servants in the land.
But now you're conflating the moral argument with the actual physical reality of being a junior doctor.
Let me tell you
why should their quality of life be worse than it was in 2008? Why should it?
Last year they got a 22% pay rise.
Yeah, and they've had 30% taken off them since 2008.
No,
so they're still not up to...
Those figures have been totally disproven. Because what they do is they base what they've lost since 2003 on the retail price index figures. The real way they should have done it is the consumer price index. And the Institute of Fiscal Studies has rubbished their claim.
But in the end, Carole, if they want more money, they can get it because they're powerful, right? There's nothing to do with the rights and wrongs here.
You touched on it in the intro there. What they're doing this time round, because what has happened in the past, they go on strike and the senior doctors cover their work. So what the BMA have done today is they put out a statement saying that patients are going to be in danger because senior doctors are not going to be allowed to cover emergencies because they're doing all the routine appointments.
Because they're taking it the other way around,
So why is it the senior doctor's job to protect junior doctors' strikes? The only people who are going to endanger lives here are the people who are going on strike. And we know that during the last strike...
Because once they make... I know you're complaining about it, but once they make a demand... And, in a way, it doesn't matter what the figure's justification is.
They got 22% last year, plus they've had another 5.4%
you just say they're wrong.
this year, and they're asking for another 29% over the next couple of years. So I'm sorry, to ask for a 60% pay rise over 2 years is nonsensical.
Would you work for less today than you got in 2008? Why would you? Would you work for less?
Let me answer your question.
Why should their quality?
Let me answer the question.
Why should their quality of life be worse?
Let me answer the question.
Carole can answer it. Yeah.
Let me answer the question. They're not getting less now than they were in 2008 because those figures that they base them on have been debunked by the Institute of Fiscal Studies.
James, is there not another answer to that, which is that Imogen, who you quote, wasn't working as a doctor in 2008.
Exactly.
She was at school, so she knew what she was getting into.
Yes.
And she made a choice. And to say, OK, I want to be a doctor and I want to be paid this much, and then when you get there to be surprised by how much you've agreed to be paid and to go on strike, doesn't make any sense.
Appalling.
But if we carry on underpaying doctors,
We're not underpaying.
Hang on, Carole. Let's finish.
If we carry on underpaying doctors, we're just going to lose them. We're going to lose them
And
to
that's it,
Australia.
Carole, in the end, that's the point.
We're going
That's
to
the point.
lose them to the private sector.
Yes.
If you can't say in one breath that you really value doctors and this important job that they do, and morally they should uphold some ridiculous ideology that they can be paid whatever we deem fit, and in the same breath want them to stay working for the NHS.
The ones who go to Australia, the reason they get paid more in Australia is because it's a private healthcare system. That's why they get paid more. In this country, the BMA does not want a private healthcare system. They want it kept as NHS. So, but these people, I get sick of hearing how underpaid they are. They are not underpaid. They're some of the highest paid public servants in the land. Plus, their pensions are way more than you or I or he will ever get. That is a fact of the matter.
Let's go to Peter in Wolverhampton. Peter, you are in favour of the strikes, I gather?
Absolutely.
Tell Carole why, because she's put up a doughty criticism of them.
Yeah, well, Carole sounds like she's having a bit of a breakdown. I think
that's really insulting and patronising. How dare you say that to me? Is it because I'm a woman, Peter?
Well, no, it's because you're a Tory witch.
No, you can't call Carole a Tory or a witch.
Yes, exactly. Off you go.
Peter, you're on a yellow card.
What do he gets to call me a witch and he's on a yellow card. He should be off.
I think he's been taken out by a third party.
Good.
OK. Joe, yeah, well, that's right. Witch is a red card.
Which should be a red card. But
also, Tory is not, would you accept Tory or not?
No.
OK.
I'm certainly not
you
Tory
can call, well, you're not Tory at the moment. No. OK. Which of those two words is the more problematic? All right, Joe in Sheffield, you've got to pick up where Peter left off. Peter exploded. Go on.
Sorry, it was just that which of those two words is the worst. Sorry.
Only because the Tories, I should say, from an impartiality point of view, because the Tories are having a bad time at the moment, that's all. Right, I don't know about witches, they're not having a bad time. Right, Joe, on you go.
OK, in defence of Peter from Wolverhampton, I've heard him before speak, and he's really great, and he shouldn't have said that, Carole.
Well, also, I didn't take him out. Someone else pulled a lever on him, so I don't know what's going on there. So I apologise to Peter as well.
No, it's OK, but he is generally really
yeah, no, he's been on a lot. Oh, we think he hung up.
OK.
He hung up.
Okay.
He basically unloaded the word witch and hung up.
So you really think anything a bloke like that says is worth listening to, Joe? I find that
he's really fabulous. He's really fabulous.
Do you know him, or do you know Peter from Wolverhampton then, or you've heard him on the show?
No idea. I just know he's made a lot of really good contributions about comments about people with disabilities and things like that.
I know that he has had.
Just from here.
But it's funny when you say that, because Peter, I think, has had his own breakdown and is off work.
Exactly, that's what I'm referring to.
Isn't it strange that somebody who's suffered real mental torment then says to Carole, it looks like you're having a breakdown, which makes his contribution even more disgraceful.
Well, I did just start by saying it was unacceptable.
No, you were laughing, though. You were
laughing.
laughing.
You were chortling. I don't think she was laughing.
I was laughing at what Jeremy said about which of the two words is the word. I
can't even remember what the item was about. You fire away, dear Joe, and then we'll take our break.
Thank you, lovey. Thank you. OK, I don't think that it's reckless, but I think that it's irresponsible because they don't have the public support behind them.
You agree with Carole?
Yeah.
No, but I think the essential problem is that the government's last pay rise, there was no contract of no strike for 3 years, and that was silly. It was a cock-up. Yeah. However, what I think it should be the solution is that they should be paid absolutely the amount that they want, but they should have to work weekends.
They do work weekends, Joe. They get overtime.
Well, they get overtime.
They get overtime.
Exactly.
Yeah, but Joe's on your side here.
Okay. And honestly, Carole, they're not there at weekends. I've been there on a Friday. I've had several over the last 5 years, long-term admissions. I've been fully well on a Friday afternoon and been told that I can't leave until Monday afternoon, fully well because I couldn't get discharged, which left me with the most awful moral conundrum. Do I wait till I'm absolutely discharged properly and formally, or do I go with my morals because I'm taking up a bed for 72 hours, and twice I've actually walked out myself on the 7
there we
o'clock
are.
on a Friday.
You can do the old Jack Reacher and just walk out of hospital. That's right. But it's true. I don't know why you're saying they all work at weekends. When the hospitals I've been in at weekends with relatives, it's like something out of a Stephen King film. But you can hear your footsteps echoing in the corridor.
But you know what I think is this? I think last time they did have the public support and they got their bumper pay rise. And Joe's quite right. West Streeting was an idiot not to put clauses in their contract because, of course, if you get 22% one year, I think you're going to get...
But they'll just strike the year after anyway.
But I mean, I still think that, if... I think doctors should not be allowed to strike. I think if coppers can't, if firemen can't, I don't think people who are in the business of saving lives should either. And the BMA have said now that lives will be in danger, but they're still going to walk out because they're still going to leave those people in danger. And we know that 5 people have died in the last leg of strikes, in the last industrial action they've taken. So more will die this time.
And of course, this time, by the way, it's what they're trying to do, the NHS, is to keep the operations going, the appointments, and that'll mean fewer staff at A&E. So there's a whole other thing of whether we, don't use a ladder on Friday. We've got to take our break.
But isn't the point?
We've got to take our break. Okay. Now your calls on whether doctors are being reckless by striking. Up to 50,000 resident doctors in England are expected to walk out for 5 days from Friday. The Health Secretary is furious. Are you? 0207 862 2222. Charlene in London, hello.
Hello.
What do you think?
I stand with the doctors 100%. We should pay them what they are worth. We always talk about paying people their value. We value our doctors, so we should pay them.
So when you say pay them what they're worth, you mean pay them what they want, correct?
Yes. I believe pay them what they want.
Help me understand this, the point I made earlier, which is that if a doctor is so young that they weren't working as a doctor in 2008, they can't complain that their pay has fallen behind, can they?
Yeah, they can, because in 2008, what you get paid is less valuable. So but
they weren't working. If I'm saying they weren't working then, they weren't all working then. They took the job knowing what the pay was.
They may not be working then, but the point is the value of what they were worth then should be the same.
Yeah.
So a house price in 2008 is not the same as in 2025. The rent from 2025 is not the exact same as the rent in 2008.
They're not being paid the same now as they were being paid in 2008. It's a daft comparison.
OK. All right, Charlene, thank you. Alexandra in Doncaster, do you support the doctors striking?
No, I don't. And I don't value doctors at all. I think their attitudes are dismissive and condescending. It's very difficult to come by a good doctor who actually cares and has the correct, reason for doing the job. I mean, I've had really bad experience with doctors. My mum was going to the doctors for 2 years with some really severe symptoms, and they kept dismissing her with stress. And it turned out that she actually had a stage 4 tumour, and she died.
Oh, no. What, a brain tumour?
No, she had stomach cancer, esophageal cancer.
Oh, OK, so they thought the stomach pain was stress-related, yeah.
Yeah, they didn't look to do any scans or investigation, anything. And then last year, I found a lump, and I went to the doctor, and they prescribed me antibiotics 3 times in a row. Now, anyone that knows, antibiotics are terrible for your gut, and I naturally suffer with gut problems, and they refused to investigate my lump, even based on the fact my mum had died from cancer, and I was lucky enough to be able to afford to go private for scans.
OK, and what happened?
It turned out that I needed an urgent operation, and they just totally ignored it.
OK, thank you, Alexandra. That's a litany of disaster, really. Although other doctors have done much better. Douglas in Devon, are you thinking they should strike or not?
Absolutely, yeah. I'm not 100% sure of this, but I've got a couple of lumps on my shoulders that are really, really painful. My doctor got me to a diagnosis clinic pretty quick to check if it's cancer. Like I said, I'm not 100% sure, but it's been it was all right 2 days ago, but it's been cancelled now. And do you know what? If it is, and it's too late for me, so what?
Wait, hang on. I've got to think this through. You're saying you're in the middle of a cancer scare. Your appointment to diagnose your lumps has been cancelled because of the strike, and you still think the strike is right?
I'm not 100% sure it's been cancelled, the strike. It was all right 2 days ago, but I've had it cancelled. But what I want to say is, if I'm a victim of this strike, so be it. Because
James, James, can you factor I can't even imagine what's going on here with Douglas. I can't. This is the least selfish call I've ever heard.
Yeah, I mean, fair play to you, Douglas, for
he's just crazy
for standing up for what he believes in. He this is someone. Our previous caller started their call by saying, "I have no respect for doctors."
Right.
And then Douglas, who's at the other end of the spectrum, who's going through something quite terrifying, is saying, "No, actually, doctors do deserve our respect."
But what Douglas?
Douglas,
£17 an hour is a disgrace.
Douglas deserves more from the NHS, which he has paid into all of his life, than this shoddy treatment. It is appalling that he may well get cancer, and I hope it's not, Douglas. My God, I hope it's not.
Yeah.
Because he's entitled. We're all entitled to be treated
and they're
on
entitled
the
to
NHS.
decent living conditions.
And they have decent living
decent
conditions.
Carole.
They have better living conditions. You refuse to accept what they get paid. A doctor incrementally, every single year that they're in practice, goes up. So by the time they're in year 3, the beginning of year 3,
we're going to look at some numbers.
They're on nearly 60
Douglas,
grand
look at
a
the
year.
numbers with me. Because we keep going on about these numbers. Let's just say foundation doctor year 1, basic 36,000. The BMA demand 47. This is the jump is that. So this is what it is going to be: 25, 26, 38.8. Foundation doctor year 2, looking at 44.4, 44,500. BMA wanted, or at least it's really clearly comprehensible figures, to 54,000. Core trainee speciality registrar, so moving up the ladder. This might be year 3, 4, 5. 53,000. BMA wants 64.4. Speciality registrar, 65,000. BMA want 80. Speciality registrar, the next stage up, 73,974, and BMA want 91. So I suppose A, this shows that the salaries move up. B, it shows that there's quite a big jump in what the BMA would like them to become as opposed to what they are now. Not too big for you, though, James.
No, not at all. Look, I go back to what I said at the top of the show, and I know Carole disagrees, but these people have trained for years. They're really, really specialist. They're working in really difficult...
It's true, 6-year training.
6-year training. And also, the training doesn't stop. Like, you're constantly training, you're constantly learning, taking exams, getting qualifications. Just let me finish. And to be in a situation where you're paid less than you were, and I know what you're saying.
Well, you can't keep repeating a lie. It is a lie.
We did have a big financial crash in 2008. That's why the figures are coming from before
exactly.
that. So we then had to have years and years of austerity because the whole economy was destroyed. So that's part of the background here.
Can I just ask James a question here? Are you happy then, if the doctors get what they want, are you happy then that more people will die because there's no money for patient care, that the doctors have had it all? Are you happy? Does that sit well with you?
I don't think you can put that on the doctor's shoulders and say...
Well, you can, because what they're doing is destroying the NHS.
The NHS has been creaking at the seams for years. It's been hemorrhaging money. It's poorly run on every single level. Not just frontline. It's poorly.
Let's get one more call.
But that's the
Let's
government.
get one more
That's
call.
the
Carole,
government's
They have a budget of £200 billion.
Whose fault's that?
One more call. Richard in Buckinghamshire, hi.
Yeah, good morning. Just to put it into its right equation, it's £3,000 a month to the bloke on the right. He's saying it's not good enough. But what I really rang up to say is that they are basically putting people's lives in danger, and they are flouting their duty of care. Yes. So to be a doctor, you must first have a duty of care. And that is just gone straight out the window, and people will die. Yes. There is no debating. But to the guy on the right, they're getting £3,000 a month. That's a lot of money, brother.
OK, Richard, thank you very much. Hang on, Carole, we've got to go to our break. Thank you for all your calls. Later we'll be asking whether it's OK to wear gym clothing to the pub.